This is Dr. Schoor again. I'm going to talk a little bit today about urinary tract infections. Many times I have patients who come into my office because they are or believe they have recurrent bladder or urinary tract infections. A bladder infection means that this patient has symptoms suggestive of a urinary tract infection and the urine culture is positive. Now, I can tell you it is a bit more complicated than even that. However, the majority of these cases, patients have symptoms of urinary infections and they don't have any proven culture history. Usually, they have pain in the bladder or the pelvic area, maybe some urinary frequency, maybe some pain with urination or associated around the time of urination. They go to the doctor does a urine dipstick and tells them they have an infection. At that point, whether or not the culture is sent is usually unknown to the patient. Um, Often you have a patient who does have culture documented infections, but the samples are not collected properly, and it's possible that the urine specimens were contaminated by bacteria that normally reside in the vagina or the labia or the skin. Uh, so, as you can see, there's a lot of questions that I ask in my head and of the patient when they come to me with recurrent urinary tract infections. So the first thing that I like to do is take a good history, do an examination, and really try to ascertain how the urine specimens were collected in the past, whether they are culture documented, and what the names of the bacterium or the organisms are on the cultures, if there are any cultures. And then what I try and do is obtain good, uncontaminated urine specimens. We try to do this with voided samples, clean catch midstream. If these are positive and yet the patient does not have any symptoms or we don't really believe that this may in fact be a urinary infection, then I'll have the patient come back and I can do a catheterized specimen, uh, which will completely rule out the possibility that the urine culture is positive through contamination rather than true bacteria in the urine, or bacteria in the urinary bladder. So, what is often a simple thing like a UTI, in actuality, is a quite complicated uh, discipline within urology. Uh, uh, One of the hardest things that I do is determining simply whether or not the patient's symptoms are due to true urinary infections or due to something else. Because the evaluation and the treatments are very different depending on whether or not this is infectious related or otherwise. So if you have any questions, again, please feel free to contact me. Thanks.